And welcome to the Dr. Bob Show. Are you getting enough good sleep? Is the sleep you're getting sound sleep? Are you going to bed at the right time? Are you having trouble getting to sleep? Do you wake up in the middle of the night and can't get back to sleep? Those are all typical sleep problems causing insomnia, the inability to get a good night's sleep. We'll be talking how the pandemic interacts with your sleep pattern and what we can do to help that. My guest is Dr. Chris Nolte. Dr. Nolte is a board-certified sleep specialist, and he'll be answering our questions. I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about strictures in the esophagus, the swallowing tube. What causes those? What can we do for those? Are they dangerous? Can they cause other medical problems? A lot of information to review. You'll want to stay tuned. We're talking with Dr. Chris Nolte, board-certified sleep specialist, and he's going to be answering our questions about how to get a good night's sleep and is COVID-19, the pandemic, interfering with your sleep pattern. Chris, welcome to the Dr. Bob Show.
Thank you for having me.
If somebody's not getting a good quality sleep, how do you know that?
They are very likely to tell you. I mean, that's something that you see on a daily basis in the sleep clinic. Patients will say, well, they have plenty of opportunity to sleep, but either they can't fall asleep, they can't stay asleep, some combination thereof, and that starts to wear on them over time. It's probably the number one thing that we see.
When somebody is not getting quality sleep, how does it manifest? How does that hurt the patient?
It's frustrating to them often. So whether it be difficulties falling asleep initially, that's probably the most common thing you see. And people get frustrated they try various medicines without much success, or they don't agree with them very well, or they try meditation or breathing or try to optimize the bedroom environment, and then they kind of throw their hands up and say, I got to do something here to fix it. The other kind of patient that you see often is the patient who has symptoms when they wake, and they're just like, I feel lousy, and I didn't used to feel this way. So that will bring them in for further investigation as to what's going on at nighttime.
To feel better.
Yeah, they remembered how they used to feel, and they wake up feeling tired still, and they're tired throughout the day. They kind of power through, but they are groggy or they have that brain fog.
Why cannot people sometimes go to sleep? I don't have any trouble. I go to bed and relax, and within what I think is probably 4 minutes or so, I'm zonked out.
Yeah, that's a big source of envy within relationships often, because if you have a bad sleeper who's a bed partner with someone like you, they look over with a lot of, how can you do that? Yeah, it's often the mind. They just can't seem to, either they're not tired when they go to bed. That's very, very common. They just set their bedtime either for their own schedule or for their family member's schedule or bed partner schedule, or they're tired, but they, as soon as they get in bed, all of a sudden now their eyes are wide open and their mind's going a million miles an hour.
Are they starting to think about things they need to do the next day or what's going on in
exactly,
life?
Yeah. It could be mundane list making, it could be worries, people with like anxieties and things that are kind of ruminating over something.
Can you teach people to turn the brain off?
Yes.
How do you do that?
So that's been probably the most well-studied technique that we have for what we call insomnia, which is this trouble falling or maintaining sleep. There are behavioral things that people do that they don't know are counterproductive. Probably one of the most common is smoking. So people will smoke right up till bedtime because it's relaxing, it's their habit, not knowing that nicotine's a stimulant like caffeine. And you tell them that, like, oh, well, maybe that's why I can't, stay asleep or fall asleep.
If you can get that person to stop smoking within a couple of hours before going to bed, does that usually improve their sleep pattern?
Exactly right. So that's one of those things where they're doing something that's counterproductive or fighting their efforts, and they don't even know that they're doing something that's problematic.
So We call that insomnia. How much sleep should people get every night?
It's a bit inborn. So we have people who are short sleepers, 4 or 5 hours a night, long sleepers, 10, 12, 13 hours a night. Your average American is, again, what you know, which is probably somewhere between 7, 8 hours.
Now, if average is 7.5 hours and you're not getting 7.5 hours, or if you're even sleeping 9 hours, does that affect the person's functioning?
It does. I mean, often you'll ask people, well, how much sleep do you think you need? And they'll say 14 hours, something outrageous, right? And what they're basing that on is recovery sleep. So throughout the week, say, they're getting 6.5 hours every night. And really, they probably need 7.5 or 8. But that little bit of sleep deprivation every single day starts to build into pretty substantial, significant detriments in their function throughout the day. That's been studied on reaction time, problem solving, executive functioning, just alertness.
So how do you teach people to prepare them? I know there's certain things we can do to get ready to go to sleep. What do you teach patients?
Yeah, we're not much different than our children. So there's a lot of emphasis on that bedtime routine for little kids. You bring a kid home from the hospital and they hand you books, and there's family members weighing in on what to do. And many of those techniques are the same things that we apply for our adults. Part of the trick about the bedtime routine is a training. You go from the TV room to the bathroom to take your bath, to the bed to read your book. That sequence of events stays consistent night after night, and it starts to prepare the person mentally, like, all right, I know what's going to happen now. I go from here to here, here to here, and that's sleep after that.
Yeah, and that begins to train the brain to get ready to go to sleep. What do you tell the people to do? You start turning off computers and cell phones, you turn those off, you don't text. What do you tell people not to do?
Yeah, that is the biggest thing that we deal with these days is technology. And so I always think about pioneer living when people have troubles with their sleep. I'm like, remember that show, Little House on the Prairie or one of those? That is the way our brains are designed. When you are up early, you're out, you're active, you're getting plenty of sunlight throughout the day. Then when the sun sets, you're in, it's dark, the lights are dim, the activities are relatively passive. Clear difference to the brain between day and night. Where to keep you awake, where to put you to sleep. Modern day living, particularly in COVID times, where you're inside all day, either you're doing Zoom calls or you're doing school or just, you just don't feel like getting out or you can't go out. You don't get much sunlight. And then at nighttime, you're up late watching your phone or your TV or whatever. And so now the brain has a much more difficult time to figure out when to put you to sleep. So that is probably the number 2 reason why people come in. They come in saying, well, I can't fall asleep. And you ask them, well, are you tired when you go to bed? Like, no. Like if I could set my own schedule, I'd stay up till 2 or 3 or 4. And then I could sleep till 2 in the afternoon. I'd be fine. It's like they're in the wrong time zone, really.
Is there something called circadian rhythm that the body has its own internal clock that says you need to go to bed at a certain time?
Yeah, that's exactly right. So that's what we're talking about here. This is a circadian rhythm shift, almost like a teenager. So as you know, it's pretty normal for teenagers to want to stay up late, sleep in late, not just being lazy. That is a true biological, physiological delay in their rhythm. And if we're not getting a lot of sunlight, we'll do the same thing.
Where does melatonin come in with that type of sleep pattern? Does it help the circadian rhythm? Does it help the brain think it's time to go to bed?
Yeah, that's probably the sleep aid, if you will, that almost everyone knows about is melatonin. And they'll try it, say, it doesn't work for me. It's not the same as a true sleeping pill. And you can say that's Ambien, Lunesta, or there's a bunch of those. Those are sedatives. Melatonin is a hormone, and it's the hormone that your brain makes when the lights get dim. And so when the sun sets and the lights get dark, melatonin is released at high levels, and it clues the brain in like, hey, it's time to get sleepy. So if you take it in pill form, you're getting that same peak now because you're taking it, but it's a sleep cycle regulator more than a sedative. So if you take it at the same exact time every single night, it can take a couple weeks, but over time, your body rhythm starts to sync up to that.
What concentration, how much melatonin do most people take, most adults?
Probably 3 milligrams. That's probably the most common. There are different forms out there. There are immediate release and long acting that come in different strengths. 3 is plenty for our purposes. The amount you need to help entrain your rhythm, in other words, get it on the right track, is very, very small. And actually, as you go higher and higher on the dose, sometimes it's counterproductive. People start to get more side effects from those higher doses, and there's no real evidence that it helps anymore.
What time should people wake up in the morning? 5, 6, 7?
Again, some of that is set by their body rhythm.
And that's what we're going to be talking about. How do you know what your body rhythm is, how it's set as to what time you should be getting up in the morning so that you feel good and you feel rested and you feel ready to conquer that day? A lot of information. We're talking with Dr. Chris Nolte, board certified sleep specialist. We've been talking about how to get a good night's sleep. How do you know if you're getting a good night's sleep? How should you feel in the morning when you wake up? And now we were about to say, what time should you wake up? Well, what time should people wake up in the morning? If they go to bed at 10 o'clock, when should they wake up?
They often don't have much choice. They will wake either by their body rhythm, and often they'll do that out of a dream. So there are different stages where it's easier to wake somebody. So if you wake up out of light sleep or dreaming, you don't have the hangover, sort of what we call sleep inertia, that makes you feel so groggy and you just can't seem to get going or clear your head. If you're in a deeper stage of sleep and you wake someone up, they'll often can even act confused, and it's really hard for them to sort of come to.
So people set an alarm clock to wake up so they can prepare for the next day's activity. Does that alarm clock, if it goes off at 7 a.m. or 6 a.m. every day, is it likely to hit in a good time one day, one morning, and a bad time another morning?
Yeah, quite hit and miss. Actually, so this is where some technology comes to our aid. There are smart alarm clocks where you can set a range of times during which or in which the alarm will sound based on if it detects movement from you. So you tend to move and jerk a little bit when you're dreaming. If you've ever seen pets dream, they kind of twitch their feet. We do the same thing. So if it senses that, it's like, oh, they're either in light sleep or dreaming, I'm going to trigger the alarm now so that you can wake up without so much grogginess.
So good time is right after dreaming, or right at the, during a dream, end of a dream, somewhere right around in there.
Yeah, generally people will wake right at the end of a dream.
You mentioned earlier the importance of light, getting enough light exposure during the day. When you wake up in the morning, in the winter, it's dark. What kind of light should you expose yourself to?
Morning light is the key thing. So that's where winter becomes quite difficult for a lot of people.
Yeah.
You know, to get up and get going and that kind of thing. So if you wake and get plenty of morning sunlight, that's the most powerful time for that light to influence your rhythm and set it. Otherwise, what you end up getting, like if it's dark and you go to work, by the time you actually see the sun at your lunch hour or something, there's very little influence over that sunlight on your rhythm. So your tendency might be to want to start to drift a little bit and go to bed a little bit later and sleep in a little bit later, and it gets harder to wake in the wintertime.
Is there a certain type of light bulb or light exposure that you should turn on in the morning?
So white light, all colors of the rainbow, works, and it's probably the least expensive. And for this purpose, it's the blue part of the rainbow. It's the blue light that influences our rhythm. So white light works. They actually make blue light boxes. So if it's dark outside, no sun, you can actually buy a light box to turn on in front of you while you're having your cereal or reading the paper or what have you, and that will do the same thing.
Philips, I've seen some advertisement, makes a light that simulates the sunlight when you wake up in the morning. It said that should make the brain feel better and make you wake up better.
That's right.
So it's an important part of sleep pattern. If you're getting ready for bed, let's go back to getting to sleep. How should you prepare yourself again? How do you tell yourself, what do you do?
You use behaviors to kind of help get your mind in the right spot. So what we see a lot is that people don't follow a routine. Every night's a little bit different. And so sometimes they'll doze off on the couch and then go. Other times they actually go through the routine and prepare. So when you're very erratic night by night, there's no training. We're not much different than our pets. That behavioral training is super helpful because you got to prepare the mind to wind down. If you're getting lots of light, you're exercising real late, you're doing chores, that happens a lot. People are working right up to bedtime. Too much mental stimulation is very counterproductive. You got to build in some time to wind down and actually prepare and relax.
So I think my wife is a perfect sleeper in that 2 hours before she's going to go to bed, she says, it's time for me to quiet down. I'm going to go in the bathroom and relax and listen to some music and whatever ladies do in the evening. But she prepares herself. And then when she goes to bed, she makes sure the room is dark, that there's no noises outside of the bedroom. And she really prepares herself well for sleep. I'm not that way. I run into the bed and say it's time to sleep.
Well, I think that kind of routine becomes very important for people who struggle. If you're doing fine and you're kind of like, well, you're free to do what you like. But when we're trying to sort of coach people who have had problems with falling asleep in particular, that routine that she follows is exactly what we would tell them to do. And there are people who are actually board certified in this, in what we call cognitive behavior therapy, for insomnia. There are cognitive behavior therapies for anxiety or depression, but these people are actually trained just in sleep management. And that's some of the behaviors that they coach. They also teach you some techniques to calm your mind down and take that racing million miles an hour thought process and slow it down so you can fall asleep.
So sleep in itself is an amazing science, trying to teach people how to get a good night's sleep so they feel well. And when we don't get a good night's sleep and we don't rest well, and what are some of the side effects you see that are obvious something's happening?
Yeah, I think all of us have been there before. The part of the brain that's most susceptible to bad sleep is in the front. And that's where our behavior is, our mood. We can get cranky, we can get short-tempered, just not ourselves forgetful. It's part of the memory circuit. That's probably the most common that we see. You can get some health effects too on cardiovascular health. If you're just being sleep deprived or not getting enough sleep, it affects the immune system. So in this day and age, when we're talking about vaccination all the time, it turns out that if you are sleep deprived, your body may not mount the same immune response to a vaccine as people who are well rested. And that's been demonstrated for hepatitis, for some other kinds of vaccines. So the counseling always was, be sure when you're heading into that vaccine that you are getting plenty of sleep, you're well rested, you want your immune system at full strength so that when you get that vaccine, it can mount the appropriate response.
I've heard my wife say there's nothing as valuable as a good night's sleep, and I think that's really correct. When you look at your activity and how alert you are and how you interact with people, how your happiness is better when you're sleeping better.
Yeah, I think that's why I like sleep. It's, unlike most of medicine where we sort of chop the body into territories and you go to the heart doctor or the lung doctor, sleep is a function. And I think now the verdict is in. So many different specialists who are focused on the heart say, CEO, look at the effects of sleep on that, or on the lungs or the brain, memory and seizures and strokes, all those things that the neurologists care for, like my old training. They're seeing now the effects and the importance of sleep on all of those conditions.
So are most of those from obstructive sleep apnea or from just inadequate sleep? Is there any special part of sleep problems that make people more prone to have trouble with their brain, with their heart, with their lungs?
Yeah, I would say sleep apnea is probably the most common and the most well-known. I think most of the folks out there have heard about people who snore, and maybe that's not good for you. It's not just silly anymore. What we see sometimes is that short sleep. So there's been well described that spring ahead that we just did, that daylight savings time is associated with higher rates of car accidents, heart attacks. Because of that, you're getting that 1 hour less of sleep, and it puts strain on the body.
Can you help people stop snoring?
You can.
And that's what we're going to be talking about when we come back. Is somebody in your bedroom snoring? If they are, we'll see what we can do to help stop that. We're talking with Dr. Chris Nolte, board certified sleep specialist. We've been talking about the importance of getting a good night's sleep. What are some of the problems that keep us from getting that? What time we should wake up? And then we began to mention snoring. So snoring is a big problem listening to patients. I always tell them there's three things that cause snoring. A bad nose, so you got to figure out why it's bad, because makes you pull and makes you snore. Mm-hmm. Bad throat, if the throat is built for a snorer, and a bad belly, because again, you have to pull to take a breath in. So all of those create snoring possibilities. How do you tell people to stop snoring?
To address those three things, actually. So nasal congestion, as you know, is so common in this part of the world. So we need to make sure that we're managing that. Our concern is the lower part of the airway, sort of behind the tongue, above the Adam's apple. That's where sleep apnea occurs. So we don't think that snoring carries with it too many health concerns. It's annoying lifestyle-wise and can be quite disruptive to a family unit. But we're concerned, like, well, is that person just a snorer, or do they have sleep apnea? And if it's sleep apnea, how bad is that? Because now we're going to start to take some actions to correct that. And part of the management of that condition is weight loss, breathing training to strengthen these upper airway muscles. But weight loss is potentially curative of that. Some people only have snoring and apnea because they're too heavy.
And as you listen to patients, they say, when I lost 20 pounds, my snoring went away.
Exactly right. Yeah.
And I say, don't get that 20 pounds back. So if that helps, are there things you tell people to do about snoring? How about sleeping on their side, on the back, front?
Exactly right. So position matters often for this. And most people are worse when they're on their back, when they're dreaming. Women in particular will be that way, where they fall asleep fine, but they wake up on a very predictable hour and a half, 2 hour, I don't know what wakes me, but I get up and I go to the bathroom, I come back, fall asleep. That often indicates a little bit of dream-related sleep apnea. And women tend to have that pattern more than men do.
When people have sleep apnea, I understand that the back of the throat actually closes off, so you can't get air by there. When that happens, you don't get any oxygen to the brain, and that creates big-time problems.
Yeah, the body senses there's a problem there, because the air you're trying to breathe in gets blocked, can't get to your lungs, so the oxygen level starts to drop, and that fight or flight system, that adrenaline system kicks in to jar your brain awake. And so people with untreated apnea, they may or may not complain too much about their sleep quality. You're a little bit restless or something, but they often will wake feeling like they didn't sleep really, they didn't rest, they feel tired still. And that's often because their brain has been essentially on guard duty all night long, getting these adrenaline surges as the person stops and starts breathing.
It's a real health problem, I think. Heart rhythm problems in the middle of the night because the oxygen level goes too low. The brain fog that you can get the next day that makes you drowsy when you're driving. Mm-hmm. So it's a huge problem to get people to stop snoring. Who usually brings that person to the doctor?
You guessed that. It's often that spouse. Oh yeah. So the classic example is if you talk to the patient themselves, like, I don't feel I have a problem. I'm being pulled in here by this person over here. But an external observer, usually it's family, spouse, or if they go in for a outpatient medical procedure, the medical team will often say, after that procedure is over, like, you need to go get yourself checked.
Do most people follow those instructions?
Yeah, we see those quite often. They tend to put up more fight, I think, with their family than they do the medical team. Yeah.
What is a sleep study like? What's the best kind?
So you come in and we're actually monitoring your brain waves. That's the sleep analysis part. So people often will say, well, you can do so many different kinds of analyses, but if it's a sleep quality concern, I just don't rest well, we need to take a look at the actual sleep itself. And so we'll say, well, we'll watch you fall asleep, and every time you wake up, we look right before that to see, well, can we identify what it is? Was it a little twitch or jerk, or was it a snore? And if we can find something like that and go after it, well, then that gives us an opportunity to hopefully improve the sleep quality.
Chris Nolte, you know so much about sleep. It's really fun for me to listen to your knowledge and to learn more about the importance of a good night's sleep. And now we want to remember those 4 things we always talk about in the Dr. Bob Show. Be sure that you're getting adequate exercise. Get those tennis shoes out and start using them. You need to be exercising 30, 45 minutes, 5 to 7 days a week. Dr. Nolte and I were talking about the importance of exercise to prepare yourself for a good night's sleep. So be sure you're getting 7.5 hours of sleep. If you're not getting that, then you need to find out why. Is it medicines you're taking? Are you smoking before you go to bed? If so, there are things that you can correct and you can prepare yourself to go to sleep. Eat properly. Eat fruits and fiber. So have a good time eating. Enjoy what you eat. Eat less volume and eat better foods. And when you do that, you'll find that your weight comes toward its maximum, toward its best, and that you'll feel better. And most of all, what is it we like in the Dr. Bob Show? You know, it's that laughter in your life. The importance of laughter makes your immune system work better, make you feel better, the people around you feel better, and you will stay healthier.